Welcome back to Arab Health Week 2021 with me, Dave Sharp, your host and moderator for today. Coming up, we have Sophie Smith, but just to tell you a little bit more about what to do to get involved, of course, you can connect with other participants on this amazing platform. Use the Q&A to ask a question of any of our presenters, and also the chat. Tell us where you are. The whole idea of today is to build a community of health professionals, not just in your region, our region, but also worldwide. A great opportunity to share best practice, to innovate, to come up with ideas and to partner with others. The whole idea of today is to keep the momentum going. We're here for today, tomorrow, and a third day, but also on social media. We have a hashtag running, which is Arab Health Week, which is available on all platforms, Twitter, Instagram, Facebook, you know the score, LinkedIn. So stay in touch with each other, keep the conversations going, and let's create that brilliant community. So coming up, you can ask questions of our next presenter, who is Sophie Smith. She is the co-founder and CEO of NABTA Health, and he's here to talk about the private and public partnerships and integrated models of healthcare in the GCC region. Let's take a look at the presentation.
Good afternoon, ladies and gentlemen. Salam alaikum. My name is Sophie Smith. I'm the co-founder and CEO of NABTA Health. And today I am going to be talking to you about public-private partnerships and integrated models of healthcare in the GCC region. We will do a quick dive on some of the public-private partnership opportunities in the region. We will look at a case study that's come out of the UAE for an integrated model of care. And then we will explore some of the opportunities and best practices in PPPs from around the world and places where these could be implemented here in the GCC. First off, I'm going to give a very, very brief introduction to NABTA Health and what we do. In short, we provide personalized healthcare to women using a new model of hybrid healthcare, which is effectively an integrated model of care based on the combination of digital and traditional healthcare along clinical pathways to improve specific sets of health outcomes in women. We are data-driven and powered by machine learning. And we are also patient-centric and patient-led, or as you'll see with the wording from one of our case studies, human-centric. Today, we are trusted by women across the Middle East, Africa, and South Asia. We've served over 25 million women with health awareness campaigns. We have about 275,000 women who are active on our platform, have access to goal-aligned, non-communicable disease-oriented health and wellness recommendations. And we work with a wide variety of local partners that span the women's healthcare and more holistic health and wellness spaces. And this is one of the reasons why I was very excited to present to you on the subject of public-private partnerships and integrated models of care, because I believe that with our globally emergent digital economy, really coherent public-private partnerships will be the key to advancements across all sectors, particularly in healthcare and education. So in terms of opportunities for public-private partnerships in the GCC region, I'm going to begin by looking a little bit at the objective of the of governments and of the public sector here. Ultimately, the GCC is looking to establish itself as a global hub for medical tourism. What this means has changed slightly in flavor since the COVID-19 pandemic. Previously, a hub for medical tourism might have been perceived as an exclusively physical or in-person thing. Now there are many more virtual and remote care options available. And so the nature of being a hub for medical tourism has changed. It's now not just about the quality of the facilities and the kind of concierge services that are provided. It's about providing care that is really in a class of its own in terms of being evidence-based, value-based, patient-centric, research-led, and accessible to populations from emerging markets and beyond. So what does building this global hub for medical tourism mean to the GCC? Well, it means investing into specialized facilities or centers of excellence that employ value and risk-based care models. It means becoming leaders in the diagnosis, treatment and rehabilitation of chronic diseases, which are very prevalent here. Over a quarter of the population, most of the GCC countries, adult population, suffer with diabetes or other metabolic disorders, and almost half of the adult population is overweight or obese. It also means becoming a virtual and in-person medical tourism hub for underserved markets. And these could be emerging markets, so lower income countries across the Middle East, Africa, and South Asia. It could also mean much more established markets like China, where the ratio of people to doctors is very high. So you might have one doctor for several thousand individuals. The result of this being long wait times, lack of access, and ultimately lack of trust in the healthcare ecosystem. I believe there are kind of three core opportunities for public-private partnerships based on the overarching objective of healthcare sectors or healthcare ecosystem in the region. The first is centers of excellence, and this is an opportunity that is driven by the chronic disease burden, a burden that increasingly is shifting from public to private sectors as the care requirement is seen as more specialized and less general. 80% of beds in public healthcare facilities across the GCC are at capacity, according to a study that was done in 2016. And while there are steps being taken to address this, for example, in Saudi Arabia, where we see the rollout of multiple locally controlled accountable care organizations, the lack of beds to deal with the growing chronic disease burden is problematic. Today, 70% of rehabilitation patients for chronic diseases travel abroad for treatment. So there's a massive outflow of individuals who could quite comfortably be treated here in the region. And the same thing is true of local clinical talent. So if more centers of excellence are established, more specialized facilities attached to university hospitals, attached to opportunities for R&D and publication, we should see a greater retention of local clinical talent. And as a result of that, greater investment into and trust in the GCC as a hub for medical tourism. The second major opportunity for public-private partnerships is in home and remote care, driven by the aging population and really facilitated by the COVID-19 pandemic. And this is the same story for healthcare systems around the world. The virtual consultation providers, so in the Middle East, people like TrueDoc, people like Atibi, people like Virtual Health have seen a 500% plus increase in virtual consultations during the pandemic. Many at the peak experienced over a 1,000% demand for telehealth support, and this is settled still at probably 500% of pre-pandemic rates. So although one of the overarching drivers for home and remote care is a growing and aging population, the pandemic has facilitated this and has made it more second nature for individuals who are looking for different care options. Home and remote care is also being facilitated region-wide by massive investments into advanced technologies and fast 5G connectivity, so accessing video consultations, accessing quite complex data sets, accessing machine learning powered symptom triage, which requires multiple API calls, etc. All these things are being supported by very fast mobile internet connections and speeds. Like I said, there's an increased demand from an aging population in the GCC and also rapid growth. Bahrain is expecting to almost double its population between 2016 and 2030. There's a very youthful population, but it's also a population that from the age of 45 onwards is largely expected to develop one chronic disease or another. So the fact that there is a rapidly growing population means that the chronic disease burden is also expected to increase, and so there must be more options for care outside of traditional healthcare facilities than exist today. One of the other outcomes of the pandemic is that we've seen growing support for personal therapy and employee mental health programs. Mental health, like infertility and other hereditary conditions in the MENA region, considered very much taboo pre-pandemic, and now with many people working remotely and from home or coming to the office a couple of days a week, maintaining employee engagement and productivity has been tied increasingly to stable and personalized options for both physical and mental support from home. So home and remote care is another major opportunity for private sector companies who are looking to establish partnerships with public sector here. The third and final opportunity that I'm going to give is for medical manufacturing. So this is for the manufacturing of biopharmaceutical products and also for medical disposables. And one of the key drivers for this is the need to maintain and improve population security, another outcome of the pandemic. During the COVID-19 pandemic, we have seen global biopharmaceutical supply chains threatened. We've seen the distribution of vaccinations, for example, disrupted, large-scale wastage in terms of, or hold-ups in terms of distribution of personal protective equipment, vaccines even passing expiry dates or going bad because they have been stored in facilities that don't meet their stabilizing requirements. And all this is resulting in a desire to support the development of more localized, dedicated biotech facilities and incubator programs, a desire to invest into R&D, partnerships that can support the ecosystem from the ground up and act as a solid base for medical tourism. Only 7% of medical disposables and limited pharmaceuticals are manufactured locally today, but we're seeing pending trade deals for local manufacturing facilities, for example, for the vaccine, for whole genome sequencing with private sector companies from around the world. And again, this is all driven by a desire to increase and safeguard population security. So those are three key opportunities for public-private partnerships in the GCC. I'm now going to give you an example of an integrated model of care. This is a kind of flagship project out of the UAE, and that is GluCare, which offers next generation diabetes care using an integrated care model. Again, in the realm of public-private partnerships, these increasingly integrated models of care that allow the seamless connection of patients to, or of individuals to different providers in a network that allow comprehensive and protected data flows are going to be rapidly emergent and are rapidly emerging across the GCC. So GluCare has a number of key features associated with it. It's very much a pioneering project in the GCC. It uses an integrated model of care that takes a more holistic approach to the management of diabetes than purely traditional care models, with multi-clinician inputs into tailored diabetes management programs that are supported by a hybrid healthcare model, so combining the best of digital and traditional care, facilitating home and remote care. They use continuous data monitoring that is initiated through the distribution of a starter kit to individuals, which includes a mobile app, wearable band, and then a number of other connected devices on a needs-only basis. GluCare is one of the first organizations in the region to use targeted digital therapeutics Prescription digital therapeutics are relatively new to the market globally. Targeted digital therapeutics, very new to the GCC, and these provide personalized insights, risk factors, and recommendations provided through real-time data analysis. The way that GluCare is set up, so enabling more touch points, more remote touch points, facilitating low-cost access in real time, allows all of its resources in-house and in clinic to be more effectively optimized, thereby reducing the cost of care provision for both the provider and for the patient. It's a human-centric model of care, very much centered around the individual and their data and their interactions with the various touch points that they're given, whether it's a mobile app, access to specific clinicians and other Internet of Things devices. And the objective of GluCare is to enable more meaningful, impactful and supportive connections with patients, as well as obviously improving health outcomes. And they use a comprehensive partner network. So again, I think when we talk about public-private partnerships, and I'll come back to this when I give some examples of best practice models from around the world, we're not just talking about interactions between one public or between the public sector and one private sector company. We're talking about an interoperability that is enabled from a digital infrastructure perspective that allows multiple partners, along with public sector entities, to interact together. Just a few statistics from GluCare. So with their 90-day pilot, they saw an average HbA1c reduction of 1.7% points over 90 days, just a 1% reduction, which is what was achieved or what has been achieved by various other kind of market-leading entities around the world, has been shown to drastically reduce the likelihood of developing additional complications and other chronic diseases later on in life. A 4.7% average reduction in total body weight, 25% average reduction in low-density lipoprotein, so the bad form of cholesterol, 53 times more patient engagement with educational content. And this is important because if you're building a human-centric model of care, there is an assumption of a substantial educational component that allows them to be at the epicenter of their care. 14 times more weight and BMI data points analyzed. So a lot of data analysis, patient centricity at the core of the model, and integrated in terms of the interactions of multiple partners for the provision of care. Next, as mentioned before, I'm going to actually look at some public-private partnership best practice examples from around the world, and a number of key takeaways, each of which is different, each of which showcases the opportunities for public-private partnerships and their development and implementation here in the region. So I'm going to start by looking at the UK, and specifically looking at the UK in the context of its response to COVID-19, which has seen a massive overhaul in the method and model of interactions between public sector, so between NHS England and third-party contractors. So some of the highlights during the COVID-19 pandemic, and this is as reported by CBI last year, 579 contracts were awarded by central government to combat the pandemic. Of those, just over one half were awarded to new suppliers. And these covered everything from location identification to the provision of e-prescriptions, to the provision of virtual consultations. The NHS typically, and we're going back maybe 10 or 12 years here, exclusively awarded public-private partnerships to large-scale entities for multi-million-dollar ticket sizes. Many of these contracts were much smaller, and many things about the process of allocating contracts changed during the pandemic, with phenomenal results, not just in terms of access to care, but also in terms of health outcomes. So one of the key examples was that in collaboration with a number of third parties, it took, when there were fears of ventilator shortages, 100 days to design and manufacture clinical grade ventilators from scratch, using third parties who had never manufactured medical equipment before. Some key takeaways, and these actually, there are four main principles, I guess, that are takeaways for public-private partnerships in the future. To widen the public sector market, so to have a more open-minded approach to developing, piloting, supporting partnerships between the public sector and new, particularly technology-enabled healthcare companies. That procurement processes can be simplified and must be simplified, and without any detrimental effects on either health outcomes or interoperability. Previously, the timelines for procurement with public sector were lengthy. These were shortened to months, and in some examples, weeks or even days, to meet critical care requirements of the UK population. That building strong supply relationships and maintaining an open dialogue is important. I suppose that's a given, and that it's important to support innovation with an eye on future-proofing the digital infrastructure for the NHS, and also building long-term relationships. So for the UK, it took a pandemic to really revolutionize the way that it thought about public-private partnerships, but now with a myriad of healthcare companies, private sector healthcare companies supporting NHS operations, and the NHS is probably stronger than it has ever been before. The second example I wanted to give was of Estonia, which has been identified by Wired, among many other organizations, as the most advanced digital society in the world. This is applicable, actually, the key takeaways and insights, not just to the healthcare sector, but to public-private partnerships across industries. Some key highlights of the Estonian economy: 99% of state services are online, and 99% of Estonian residents have ID cards, of whom about 70% use them regularly, either through mobile or through digital methods. There are 2,600 plus services that can be used via X-Road. So X-Road is a massive connected database and digital infrastructure that allows the seamless interaction of and collection of data from public and private sector companies. Many of the transactions through X-Road are blockchain enabled and ledger based, but the digital infrastructure that has been built here, and it's one of the reasons why Estonia is reliably named in the top 5 in 2019 as number 1 on the Digital Health Index, is that it allows the seamless collaboration of public and private sector companies in the delivery of healthcare. And what this means for individuals is that they have access to their health data no matter where they go, no matter which providers they see, which obviously is one of the key things required for true human or patient centricity when it comes to the management of healthcare. The key takeaway here is that investing in a comprehensive digital infrastructure is key to supporting seamless collaboration between public and private sector companies, and having the individual, in terms of their identity, in terms of their access to data, having a very individual-centric approach is a key part of that. The last example I'm going to give is of Rwanda, which recently signed a 10-year partnership agreement with Babel, the Rwandan subsidiary of Babylon, to deliver virtual and remote care to its population. In an earlier pilot phase service offering, there were 2 million signups for Babel with a 98% patient success rate. The partnership was originally introduced to solve the problem of a 1 to 10,000 doctor to patient ratio. So there are about 12 million people in Rwanda, and there are thought to be about 1,200 specialists to attend to those 12 million patients. The takeaway from the Rwandan example is that long-term relationships between trusted private sector companies such as Babylon and the public sector can enable the complete overhaul of an entire industry. So Rwanda is one of the first countries to see the digitalization of its healthcare infrastructure end to end. It's one of the first countries around the world to make access to doctors, or remote access to doctors via virtual consultation standard. And this digitalization of the healthcare sector is now extending to multiple other areas of the economy, with significant kind of knock-on effects in terms of the efficacy of the national economy, in terms of safety, in terms of its prospects as a hub for tourism, for medical tourism in neighboring African countries, etc. So that is the third example of a country that has utilized or prioritized the introduction of public-private partnerships to its benefit. In conclusion, the GCC is rife with opportunities, not just for public-private partnerships, but in general. I've listed here 6 examples where private sector companies that are interested in establishing themselves in the GCC and wider emerging markets should be focusing, because there are gaps currently, but there's also significant growth. So the first of these is in B2B healthcare expansion. There's been significant investment in the last few years into digital infrastructure to support home remote care options. Many of the companies that have secured the largest venture capital funding rounds have been in the B2B healthcare space, whether Visita or Atibi, or even Babylon, which secured over $550 million of investment as part of its Series C, of which a significant portion came from the Public Investment Fund in Saudi Arabia. Consumer healthcare is relatively nascent here, but it's a sector that will grow rapidly. And so for companies looking for expansion opportunities, for opportunities to become more engaged with the public sector here, consumer healthcare is a sector that offers sizable first mover advantages. The Ministry of Health in the UAE has been very active in the last 12 months in terms of beginning to engage smaller private sector companies. It ran the Be Bold accelerator for youth empowerment last summer, which took kind of 15, 16 thought leaders from public and private sectors and had us all looking at ways in which we could introduce programs to materially improve the delivery of care in the UAE. It has now established an innovation community of practice, which continues that work. So looking at opportunities for public and private partnerships, looking at opportunities for innovation within the public sector to support the better delivery of care, UAE and then ultimately GCC-wide. Another opportunity in the GCC region is in the establishment of specialized venture capital funds. At the moment, most of the VC funds in the region are very generalized, investing predominantly into e-commerce, marketplaces, logistics, and fintech. We have in the last 2 or 3 years seen more interest in establishing specialized funds either in fintech, edtech, or in health tech. And there are definitely more opportunities here, especially as we see private sector companies coming from abroad to invest into R&D, to invest into public-private partnerships, who are looking for potential acquisitions or collaboration opportunities. The fourth opportunity is in R&D. Again, we've seen an increasing interest since the COVID-19 pandemic in the investment into R&D to support everything from medical manufacturing to care delivery across the UAE. There is a unique opportunity here in the GCC in terms of having consolidated healthcare data systems for diverse and largely underserved populations, which makes the GCC as a partner for research and development across the healthcare industry, whether in pharmaceuticals or in medical device manufacturing, a perfect partner. The establishment of grant funding mechanisms is another opportunity for private sector companies looking to establish a foothold in the region. There are an increasing number of local companies and also local entities supporting R&D out of universities that are dedicated and focused specifically on discovery and pre-commercialization phases of R&D. And there is a need for grant funding mechanisms to support these, and then for companies who are willing to support with the commercialization as companies exit the R&D phase as well. And the last major opportunity in the GCC for public-private partnerships is for entry into emerging markets. We at NAB2Health have always viewed the GCC as a springboard for the exploitation of untapped market opportunities in the Middle East, Africa, and South Asia. And exploitation is a strong word, but the underrepresentation of populations from these sectors historically, or from these countries, these parts of the world historically, can't be underestimated. 92% of clinical trials still occur in the US and in Europe, and the remaining 8% mostly occur in the Far East. We've seen time and time again, especially during the pandemic, how health outcomes from people in the Middle East, Africa, and South Asia have been worse compared to their white Caucasian counterparts. And so for companies who are looking for ways to establish additional revenue streams or strengthen, even diversify their existing product offerings, having a presence here in the GCC, collaborating with the public sector is an excellent way to start tapping some of the market opportunity that is the MEASA region. So that, from me, is it. We've had a look at opportunities or the objective behind a lot of the public-private partnerships that are happening in the GCC today. We've looked at 3 key examples of opportunities for public-private partnerships in the region. We've looked at one case study for an integrated care model that, with the drive to establish more specialized facilities, will, I'm certain, become more and more widespread over the course of this decade. And we have also looked at some of the best practice examples in terms of public-private partnerships from around the world. I'm Sophie Smith, co-founder and CEO of NAB2Health, and enjoy the rest of your afternoon.
And I'm delighted to say that Sophie joins us now. Good afternoon, Sophie. Thanks for that presentation. How are you today?
Good afternoon. I'm well, thank you. Better, in fact. I have to apologise for potentially sounding a little breathless during the presentation. I have been in the latent phase of labour for the last 5 days, and contractions pick up at night time. So that's the reason for the breathlessness.
Do you know, I did hear that. I wasn't going to mention it, but now that you brought it up, I mean, you are now going well beyond the call of duty to do your presentation. Join us here, which I think just shows you the dedication of people like yourself. Thanks for that. We've got some questions for you, Sophie. You mentioned the NHS in your presentation, one of the examples of best practice. One of our questions is, do you think that the NHS needs to use blockchain for a more seamless process?
I think there are a lot of questions asked about blockchain. It's been a kind of trendy topic here for the last couple of years. Blockchain, as with any other technology form, is an enabler ultimately. In the healthcare ecosystem, that means a better health outcomes. So I think blockchain has many potential applications and ways in which it can make care more patient or human centric. For example, by allowing people to be in control of their own data, logging through a decentralized ledger any occasions on which they choose to share their data with third parties, being notified of any onward sharing by third parties. It can support transactions, etc. But I think it depends on the specific health-related problems that the NHS and any other healthcare organisation is trying to solve, as to whether this is an applicable solution in that circumstance or not.
When you look at public-private partnerships, on paper they look like a brilliant combination and a great idea, but they can be quite clunky, can't they? I mean, I know that you mentioned that those processes have been speeded up and made a little bit more seamless, but in my experience, they can be, the bidding process, the tendering process, the meetings, the private sector tends to be more agile and move more quickly than the public sector. How would you overcome those challenges, do you think?
Well, I think that's one of the things that we can see from the case studies coming out of the UK during the pandemic, has largely been overcome out of necessity. My father, until recently, was the National Clinical Director of Diagnostics for the NHS, and previously was one of the national leads for PACS, which is probably the NHS's first big digitalisation programme, certainly one of its most successful. And if you compare the procurement process for PACS to the procurement processes that have evolved during the pandemic, it's night and day. Granted, we are going back 16, 17 years now with PACS, but 592 contracts signed, over half of which were with new suppliers during the pandemic. And many of these companies are relatively young. Everybody from the likes of eSurgery, founded by a very lovely woman called Turia Wenbar, actually of Iraqi origin, and that does e-prescriptions to meet some of the demands of the NHS. Vine Health, which was an app set up by a couple of female co-founders to support cancer patients with managing their chemotherapy and treatment. I mean, the NHS managed during the pandemic to pivot from an organisation with a notoriously clunky procurement process to one that was able to and continues to be able to interface with dozens of small companies in the private sector. I think it's an example of what we're capable of when necessity and demand meet, and the effect that it's had on the consumer healthcare and health tech ecosystem in the UK has been phenomenal. I think it's one of the things that I'm most hopeful for here in the UAE, that the example of the NHS and its kind of redefining of public-private partnerships and what they look like is something that could be emulated across the GCC, and the result would be more diversification within the economy, would be a sudden explosion of consumer health tech companies that are regionally focused, solving regional problems. I think the whole point of going into entrepreneurship and building companies from scratch is that you believe change is not only possible but required. And I definitely think public-private partnerships are a space where there is that requirement for change.
And it definitely requires that creative thinking, doesn't it? I mean, a lot of people, the world just stopped around about a year ago, and then people got a little bit down, and then they started to think creatively. And there are some lovely examples, aren't there, of people who previously would have said, well, I have no, as you said in your presentation, experience of medical supplies or the healthcare sector. And yet, I have a friend of mine who went from shaving products to sanitizing products and selling them online. And then there's examples of people in my industry, in the events industry, who would normally be at exhibitions helping out. All of a sudden, they're doing the test and trace, so we have to be positive, but we have to be quick, don't we, in these situations, and think creatively outside of the box.
I agree. I think a growth mindset is very important, and I think putting blockers in place for the sake of it makes no sense. I also had a cousin actually who had been in the online tie and customized tie business. And he had a lot of corporate clients, a lot of clients attached to events, and obviously when COVID hit, everybody started working from home, all of the events stopped. And he actually pivoted into an online sweet store, which I guess if you're a parent stuck at home with small children, as I am, as many are, could suddenly become something of a lifeline for you. And he found within weeks that they couldn't ship sweets out fast enough to meet the demands of the consumer. So I think having a growth mindset for yourself, being willing to embrace change, being willing to take steps to implement change are important. I also think if you're in the business of facilitation, be it in the public or the private sector, your job when you encounter somebody who wants to bring about change because they believe that there are better ways of doing things, your job is to get out of their way and to enable them as much as possible.
Yeah, and these partnerships, of course, previously people have worked in silos, they're coming together and the joining of forces. It requires some investment, just in terms of money, but time and planning, doesn't it?
Yes, exactly. So we're part of the innovation community of practice with the Ministry of Health here in the UAE. And one of the discussions that we've been having is around how we can kind of facilitate that with MOH. So there's a system that MOH recently launched to allow employees to kind of submit ideas they have for process improvement and for the introduction of new products and services, etc. And what we want to do is support them in taking the next step, which is to link those ideas that have come from inside the organization to private sector companies that have products and services that can or are already turning those ideas into reality. Because I think what is often underestimated in healthcare and health tech is the amount of R&D that goes into building a serviceable product or service. Because if it's technology enabled, not only do you need to build the technology from scratch, there's often a machine learning or another kind of deep learning component to it. You also need to clinically validate it. So to turn and get an idea from the idea stage to kind of product market fit can take you 3 or 4, 7, 8 years of R&D. And so the more that you can be connecting people who have ideas to the people who have already done something about them, the better. The more that you can enable and accelerate change instead of always feeling like you have to build something from scratch yourselves.
Yeah, and we need to be sure and clear that those people that are bidding for contracts are thoroughly looked at, don't we? Because there've been other examples of companies that have just jumped on board, they've seen an opportunity, and sometimes they're not the best people to be to providing the services.
I agree, but then again, these mechanisms that are used to make sure that the evidence base is there from a clinical and technical perspective, to make sure that the proper process is in place, that the platforms are HIPAA and GDPR compliant. They're all there already. For a lot of it, from a compliance perspective, it is just a matter of plug and play. So again, I think creating a robust framework for very dynamic public-private partnerships is actually relatively straightforward. The greatest inhibitor to this, as with most things, is the mindset of the people involved.
Absolutely. Well, and we talk about mindset. I know you've got an incredibly positive, upbeat mindset, and that you see this as an opportunity that has come from a challenge. Sophie, it's been a delight to have you to chat with. Thank you so much for your presentation, and enjoy the rest of your day. And thank you again.